Thank you, Dr. Morgenstern. And our next panelist is Dr. Kevin Jackson. Dr. Jackson is the Chief of Staff at the Uniformed Services University. And he is also a clinical consultant in the Medical Contact Lens Clinic at Walter Reed National Military Medical Center. As an optometrist and an assistant professor in preventive medicine and biostatistics at USU, he has published research in the archives of ophthalmology, written a textbook chapter on public health informatics, as well as authored policy statements for the American Public Health Association and the American Academy of Optometry. Dr. Jackson will be speaking on behalf of the American Academy of Optometry.
Thank you very much. And the American Academy of Optometry is very pleased to have been part of this effort, this collaborative effort with our fellow organizations who are interested in improving vision impairment. The Academy is primarily an education organization as well as providing support to optometric research, so this topic is near and dear to our hearts. As mentioned, I am a federal employee, so typically we would have a disclaimer, but I didn't include that because we were slide limited, but these are my own thoughts. So. Okay, so I think one of the things that is most important about the report was that there are a number of assumptions that exist in the general population, amongst our primary care providers, as well as in the vision care community. And a number of these things were dispelled through evidence provided through the NASM report. And in order to continue to move the momentum that the NASM report has generated, I think we're all interested in some initiatives that we can work on collaboratively in order to move things forward. The other thing, as pointed out by our first speaker, Dr. Guinery, the funding environment is going to be difficult. So to a certain extent, this is going to be dependent upon the collaboration of our various stakeholders and organizations to do some things on the cheap. And as mentioned, I'm the Chief of Staff of a medical school, and I look at the funding requirements very seriously, and so things that require a little funding typically tend to move forward a little bit more, a little easier. So addressing each of our primary audiences, for consumers, I would propose that, and has been mentioned in the report, the development of some patient education pamphlets or downloadables that would be available to our general public through each of our organization's websites. A collaborative effort in this is important, and if we can have a branding and a single voice as a community, I think that would be very powerful. For the key stakeholders or the organizations involved, the involvement here would be to give primary points of contact in order to help develop that material, which our next primary audience would be our primary care community. One of the handouts that I saw coming in here, this report, pretty much does what I'm talking about here, but obviously the NASM report, although very interesting to those of us in the room, and it is 600 pages long, and it's unlikely to get read by many outside of our community unless we kind of generate that level of enthusiasm. So my proposal here, or the idea here, is to generate a report that's similar to this, but really focused on the community that we're attempting to hit, and provide that to some of the leading journals for our primary care providers. Because as noted, again, in my experience at the medical school, the amount of training that our physicians receive upon graduation in eye care is very, very limited. And that's not due to viewing eye care as being unimportant, Perhaps it's due to trust in those of us who are taking care of it to take care of it, I'm not sure. But the reality is that the curriculum in most medical schools is very, very dense as it stands. And there's always a push and pull to include any additional curricular topics. So the idea that it's going to expand significantly is probably a Sisyphean task. So our stakeholders here, again, would be to nominate points of contact to help develop this content and focused on the audience involved. And then finally, even within our eye care community, some of those assumptions are still held, and there's kind of an assumption that the folks who show up to get eye care are the population that live in the area, but obviously it significantly underrepresents that population. So the folks who don't show up and aren't in our chair are as important as those who do, but unfortunately many of them don't receive any eye care or any preventative screening. So in order to build a population of folks who are, like ourselves, very interested and excited about the NASM report and the type of interventions that would be required, I would propose that the CDC or NEI invest a small amount in developing a twice yearly course, primarily online, but having a couple of 2 or 3 day sessions to help build community amongst those stakeholders. The key stakeholders in this case would nominate members for the course and help develop content for the course in order to keep it up to date and relevant. So that's my pitch. Thank you very much.